Hello, good evening. My name is Dr. Kong. I'm a consultant physician and nephrologist, and also a co-founder of Missy Care, who is running the Carehub. I'm tasked to give you a simple talk about simple first aid at home. Well, this is not a simple topic. It's actually a huge topic, as you know, because all accidents and everything can happen at home. Basically, all kind of disaster can happen at home. Since it's a huge topic, I'm not going to talk about everything, but I'm just going to summarize to you four um, incidents or accidents that could happen at home, that happen at home very frequently. I'm going to talk about burn injury, wound care, bleeding, and also nosebleed, and how to deal with it on a first aid manner. So what is first aid? Essentially, first aid is the first and immediate assistance given to any person with either a minor or serious illness or injury. There are few objectives of first aid, and of course, the most important objectives would be to preserve life, to prevent deterioration of the situation, and to promote recovery. And of course, if you're not sure about how to provide first aid, don't take a chance. Call for help immediately. Don't delay. Um, it's especially important that I mention this because we have seen a couple of situations. We have seen many situations where the delay in getting the appropriate help for a seriously injured person is due to the fact that someone is attempting to give first aid, but in the wrong manner. So please keep that in mind. What is in a first aid box? You have all seen first aid box, but what it is and what is in there. So a first aid box is a box which is usually being made of sturdy material, and it is also portable to bring to site on an incident or accident. It is usually placed at accessible location, clearly identifiable, and also well lit. First aid box, the lid of the first aid box is always locked and the key kept by a responsible person. And of course, don't let your children to get a hold of the materials inside the first aid box. The content should be completed upon the requirement depending on the location or purpose. I'm going to show you an example of a first aid box here. And of course, there are many types of first aid box, depending on whether it's for use in household or whether it's for use in some office or some buildings and stuff like that. And of course, if the location has a lot of possible and probable accidents. For example, mine area, for example, airport, and things like that, or nearby a swimming pool, you might need a very comprehensive and very complete first aid box. But if it's being used at home, then maybe you can just prepare a simple one. I'm going to start about talking to you about this burn and scalding injury. When we heard the word burn, we normally intuitively think that it is thermal burns, but there are many types of burns. Essentially, you can have thermal burn from fire or hot material or hot metals. For example, those injury caused by hot liquids and flame. And you can have radiation burn, you can have chemical burns, you can have electrical burns, and you can have friction burns. And you can classify burns into a few categories, namely first degree burns, second degree burns, third degree, and fourth degrees, differentiated by the level of the skin involved. I'm going to show you some pictures so that you have a clearer idea. So when you have first degree burn, usually it just involves the superficial surfaces. And when you have a second degree burn, usually you have this blistering. And when you have third degree burn, usually it involves the whole layer of your skin. And fourth degree burn usually looks ugly like this. because it already damaged the subcutaneous tissue and also the muscle. How about first aid for burn? Again, I couldn't emphasize enough that if you are not comfortable dealing with a burn patient, just call for help immediately. So otherwise, you can perform these methods. First of all, you cool the skin immediately. You can do it by cooling or rinsing the wounded area immediately with running tap water for as long as possible or as long as before the help arrives. And you can cover the area with wet clothes or dressing, and you can carry the patient to the hospital if the burn is very severe. How about some do and don'ts? The things that you can perform is cool the burn area, remove jewelry as soon as possible if the jewelry is not sticking to burn skin. If the jewelry is already sticking to the burn skin, don't attempt to do it because you might cause more injury. You will cause more injury to the already injured skin. And you can cover the victim to prevent hypothermia. How about don'ts? So these are the things that you can't perform in a burn patient in order to avoid further injury. So when a patient has blister, you do not break a blister. If the blister has already broken, just leave the flap alone. Do not remove jewelry that is sticking on the skin, and do not even remove the clothes sticking on the skin if the patient has severe burn. And please do not apply any other home remedies, for example, butter, hair cream, toothpaste, which can further injure the skin and also may predispose the patient's burned skin from getting infected. And I think this I mentioned already. So usually you just do this kind of methods, and you should be able to help the patient, provided that you're comfortable doing it, and provided the patient is not having the most severe type of burn. When to send to hospital, I mentioned already, you send the patient to hospital when you're not comfortable dealing with the patient. And then when you observe full thickness burn, third to fourth degree, partial thickness burn involving area more than the size of a victim's palm. And this is very important because if the burn area is involving partial thickness, and if it's more than the size of the victim's palm, is already considered very serious. They might need appropriate attention from the hospital. Or any burn involving the mouth or throat, eyes, ears, face, or genitalia area. Burns caused by corrosive or chemicals, very important. Burns caused by electricity, lethargic victim, if the victim doesn't look well, or when the burn is affecting airway or breathing pattern. These are very, very important. If you don't send the patient into the hospital immediately, it might be life-threatening. So let's talk a little bit about wound care. And as you know, wound can happen very easily, in an accident. And wound, when it happens in an accident, can be divided to open wound or closed wound. Open wound is when injuries that involve a break in the skin and leave the internal tissue exposed. For example, abrasion, avulsion, and laceration, puncture wound. And also you can have closed wound where the skin remains intact and the tissue that lies underneath is not exposed. For example, blunt trauma, contusion, blister, seroma, and hematoma. And I just want to make a point here. The fact that the patient does not have an open wound but have a closed wound doesn't necessarily mean that their injury is not serious. For example, if a patient has blunt trauma already injuring the internal organ, they might still have a closed wound. And these are just a few pictures to further illustrate the examples of open wounds and closed wounds. So you have laceration, you have abrasion, and you have a puncture wound, and you have avulsion. Usually avulsion is the most serious type of open wound. Avulsion usually occur during violent accident, such as body crushing accidents, explosion, and gunshot. And they usually bleed heavily and rapidly. Closed wound, for example, you can have a contusion or bruise. You can have blister. You can have seroma and hematoma. So again, very important that you need to know that if a patient have closed wound, doesn't necessarily mean that their injury is not serious. And this is to illustrate a little bit about the care for closed wound. You can remember it by this four alphabet RICE or RICE. R stands for rest, which means rest the affected area as soon as the pain is felt. You're recommended to rest as much as possible for at least 48 hours for the injured part. Do not try to withstand the pain by continuing to engage in activities involving the affected area, and this could worsen and delay your recovery process. I stand for ice. So you can apply cold compress to the affected area for about 15 minutes every 2 to 3 hours. It's important not to apply an ice pack directly to your skin and can cause further injury. Instead, wrap the ice pack with a towel, or if you don't have an ice pack, a bag of frozen peas or frozen corns or frozen ice chips will do the trick. C stands for compression. It's done by reducing swelling by wrapping the affected area with a medical grade elastic bandage. E stands for elevation. Keep the injured area above the level of your heart to reduce pain and swelling. And how about the care for open wound? This gets a little bit more complicated. Basically, you need to expose the wound. Use clean water or saline solution to flush away any debris or bacteria. You can do it easily and by putting the wound under the running tap water. And you should try to stop the bleeding by using a clean cloth or bandage. Gently apply pressure to the wound to promote blood clot or blood clotting. And then you can try to dress the wound and close the wound and then rotating changing the dressing. If you don't have any trained knowledge in caring for open wound, you better don't attempt to do it yourself. If you do it wrongly, it might hinder or make the wound healing slower, and maybe you cause some further injury or making the already injured wound infected. Bleeding commonly occurs at home, and if the bleeding is not very, very severe, then you can do your first aid to try to stop the mild bleeding. Types of bleeding. Arterial bleeding is very, very serious and needs urgent attention. This is the most severe and urgent type of bleeding. When you have arterial bleeding, usually the bleeding is not oozing out blood. The bleeding is squirting out blood. And usually is resulting from penetrating or blunt injury. The less severe bleeding would be venous bleeding because the bleeding is coming from the vein. And it occurs when the vein is cut or torn and the blood looks dark red and moves steadily. And then not like squirting out blood like in the setting of arterial bleeding. By the way, the bleeding from the arterial bleeding should be bright red in color. And even milder form of bleeding would be so-called capillary bleeding, and it happens whenever the skin is injured. So when you brushing the teeth, for example, and when you see bleeding, usually it's capillary bleeding. When you have a paper cut on your finger, usually it's capillary bleeding. So usually capillary bleeding would not be life-threatening, whereas arterial bleeding can be life-threatening if you don't deal with it immediately. How to handle bleeding? Always remember to put a glove on before you contact the blood because let's face it, you don't know, whether the person who is having bleeding is having any kind of infection, and you do not want to get infected. And then you expose the wound and run clear water. Apply direct pressure to the wound with clean cloth and also with direct pressure. Don't apply too much pressure. Apply just moderate, adequate pressure to stop the bleeding, but you don't want to apply too much of a pressure that you can cut off the blood supply. But of course, this does not apply to arterial bleeding. When you're dealing with arterial bleeding, which is life-threatening, do whatever you can. You might need to put the highest pressure that you can to the wound, just to make sure the victim don't die from severe arterial bleeding. And when this is a very important point to make, we have a tendency of checking under the cloth whether the bleeding still continue. For example, if you have already applied a cloth and applied pressure to the wound, and then after a few seconds, after a few minutes, you have a tendency of opening up the bandage or the cloth to peek whether or not the bleeding is still there. Try not to do it. Try to apply the pressure for as long as possible, so you'll be able to stop the bleeding for most instances. If you try to peek whether or not the bleeding is still there every few seconds, every few minutes, then you might cause the bleeding to continue even longer. Epistaxis or nosebleed is very, very common in household, as you know. Those of you who have kids will know. Just because the blood vessel in a small children's nose is not very well developed yet and is still taking its time to mature. So that's why the capillaries inside children's, especially a young children's nose, are very, very fragile. Just a simple nosebleed, just a simple blow to the nose, or if your child is having very heavy sneezing or they pick on the nose, those very, very mild trauma to the nose would be enough to cause a very severe nosebleed. But thank God that nosebleed is usually self-limiting, even though you don't do anything about it for most instances. The exception for that is, of course, if your children or if any of the victim is on blood thinner. If they're on blood thinner, then their nosebleed might continue for a very long time if you don't make an attempt to try to stop it. So this is just a little bit of anatomy here. A nosebleed is bleeding from tissue inside the nose caused by broken blood vessel. And as I mentioned just now, the medical term for nosebleed is epistaxis. Children usually bleed from the superficial and thin blood vessel that can be seen at the front of portion of the nose or the septum, just behind the nose. Nosebleed can be frightening, but as I mentioned, they rarely cause any harm to children. And this is a very good summary to what you should be doing when you're dealing with a nosebleed. So the body position should be upright. And then as contrary to common belief, we should tilt the head forward and not backward. Just forward a little bit and not backward. And we can apply the pressure to the nasal soft tissue and not the bony bridge of the nose. Just keep that in mind. So I think I mentioned this already. When to seek for medical help if you are dealing with a nosebleed at home. You can't stop the nosebleed, of course. Then you need to immediately send the victim to the hospital. Or when you have successfully stopped the bleed and the bleed happens again and again and again. Or the victim has an injury to the head or face. So the nosebleed here in this situation might not be a simple nosebleed. It might be bleeding from the internal area inside the head, in the sinus, or the bones on the face and things like that. Or if there's a large amount of blood or blood clot happening with the nosebleed, or maybe if the victim is feeling unwell already, feeling weak, feeling ill, has trouble breathing, has bleeding from other parts of the body, for example, stool, urine, gums, and if an object is stuck on your child's nose, very important. These are considered emergency. And then, of course, as I mentioned just now, if the patient has continuous or non-stoppable nosebleed, and if the patient is on blood thinner, even if you have been able to successfully stop the nosebleed for a while, I think it is better and safer to send the nosebleed person to the hospital for further assessment by the doctor. I think this conclude my simple presentation. I thank you for your attention.